Have you ever wondered how do these medications or drugs even work? For example, I have an issue in my head. I use a drug, it goes into my stomach and then cures the issue with my head. How exactly does the drug know where to go? How come these drugs never miss their way? I'm sure you must have thought about this one way or the other. Now, this is the way it works. The truth about this is that the drugs have absolutely no idea where to go. Your body is actually very smart. So whenever you use a drug, as you swallow, the body absorbs, distributes it around the body like through your blood, metabolizes the drug, like breaks it down, then excretes the excess. That's exactly what your body does to the drug. Now let me explain what the drug does to your body. So at the point where these drugs are already in your systemic circulation like this, they're flowing through your blood all over your body. One beautiful thing about your body is that at several strategic places, your body has something you call receptors. Receptors are like structures that are waiting to receive signals for them to exert an effect. So what this drug will now do is find a receptor that looks like it and just bind with that receptor, just like a lock and key system. So the drug will just, as it's flowing around your body through the blood, look for receptors that are looking like it, bind to those receptors, and once they bind like that, that is when you get the effect of the drug. So it's not exactly like the drug knows where to go. It just keeps wandering around till it finds a receptor to bind to exert its effect. Now this is why you shouldn't abuse drugs. These receptors can be overstimulated and with time they don't respond again. Now imagine you taking a drug that needs to go and bind to a receptor, but because you have destroyed this receptor, the drug will not find anything to bind to, and then you will not feel better. Same thing goes for antibiotics. Imagine an antibiotic that is supposed to be used to kill a bacteria, that is, the drug will go and attack that bacteria, but because you're not completing your dose, the bacteria remaining that you have not killed will mutate and change their structure. So once the drug comes in again, it cannot take care of that bacteria. It won't find it. Always talk to a pharmacist about your drugs. Do not misuse, do not abuse drugs. Your life matters.